Often, new parents expect their infant to look like the babies we see in commercials, with perfectly round heads and flawless complexions. But the reality is that most newborns don't look like that at all. They've been living in cramped, wet quarters, which wrinkle and often redden their skin. Babies that have been through a vaginal birth have had a journey through a small birth canal. This can result in a pointy-looking head, distorted ears, a flattened nose, an asymmetrical chin, and bruising. Don't worry. These characteristics will normally disappear in a few weeks. If you have any concerns about these conditions, please talk with your baby's doctor. Babies are born with fontanelles, or soft spots on their heads where their skulls have not yet fused. You might notice these areas moving as your baby's heart beats. This is normal. The back soft spot will close at about 6 months of age, and the front spot will close before your baby's 2nd birthday. At birth, babies may be covered in vernix, a cheese-like coating that protected their skin in utero. Most of the vernix will wash off, but some will remain and will be reabsorbed into the skin. Many babies are also covered with lanugo, a downy prenatal fuzz that is normally found on the shoulders, back, forehead, and cheeks. Lanugo will disappear within a few weeks. Newborns are affected by hormones passed from their mothers during pregnancy for the first few weeks of their lives and will be affected even longer if they are breastfed. As a result, it is common for newborn babies, both male and female, to have swollen breasts, which may emit a small amount of discharge, and it is common for boys to have swollen genitals. Newborn girls might have a discharge along with a little blood from the vagina, which can usually be wiped away on a single tissue. This is normal. If you are concerned that your baby's symptoms are unusual, check with your baby's doctor. Other common newborn conditions that appear during the first days of life include miliaria, which are small raised red bumps, milia, which are white or yellow spots on the nose and chin. Both of these conditions will go away within the first weeks of life. Jaundice is a common medical condition in newborns. Most of the time it develops during the first few days of life and is gone after a couple of weeks. More than half of babies that are born have at least a mild case of jaundice. The symptoms include yellowing of the skin and yellowing of the whites of the eyes. Jaundice is caused by excess bilirubin, a substance produced by the breakdown of red blood cells. Sometimes babies can't pass the bilirubin quickly enough, and sometimes excess bilirubin is made or reabsorbed, which results in jaundice. Most cases of jaundice do not require treatment. When treatment is needed, phototherapy is administered. The baby is placed unclothed under an ultraviolet lamp, referred to as a Billy light, or in a special blanket with a fiber optic light called a Billy blanket. Sometimes the Billy light and the Billy blanket are used together. The light causes bilirubin levels to fall to safe levels by breaking the bilirubin down into less dangerous byproducts. Babies may either be treated at the hospital or at home with a portable phototherapy light unit, such as a Billy blanket. If you think your baby may be jaundiced, or if you have any questions about jaundice, consult your baby's doctor. Thrush is an infection of the mouth caused by yeast. The symptoms are a cottage cheese-like substance that coats the sides, roof, and tongue of the mouth. Thrush is a common newborn ailment and may need to be treated with medication. Talk to your baby's doctor to determine what treatment, if any, is needed. It is normal for babies to get thrush throughout the first year of life. Cradle cap is another very common newborn condition. Symptoms of cradle cap include flaky, dry skin that looks like dandruff, or even thick, oily, yellowish scaling skin and crusting patches. You also may see these symptoms on your baby's eyebrows, ears, armpits, or neck. Frequent shampooing and brushing of your baby's scalp can help reduce cradle cap. Most often, It shows up in the first few months of life, and it usually clears up on its own after several months. However, in some cases, it can last longer. If your baby has a moderate to severe case of cradle cap, your baby's doctor might recommend a treatment.